low back pain, disc herniation, disc ruptures, disc bulges. Hi, I'm Dr. Peters with Peters Wellness Chiropractic and Massage. In this week's quick video, I would like to discuss something called leg length inequality, or short leg, functional leg length inequality, structural leg length inequality. You've probably heard these terms, especially if you know someone who's been to a chiropractor. They'll say, oh, my chiropractor says one of my legs is longer than the other. And I think sometimes there's a little bit loss in translation. And I want to just kind of describe the difference between an anatomical leg length inequality and a functional leg length inequality. So an anatomical leg length inequality is when the bones in either the femur, the tibia, in the lower leg or the upper leg, anything below the pelvis, if those leg bones are at different lengths due to some type of bone disease, or where there has been a fracture in the past, and of course, especially if it happens at a younger age, if something happens to the growth plate. So people can actually have a leg length inequality that's anatomical, meaning you can shift the pelvis and do things with the pelvis, but that leg length is going to stay there. And for people like that, you may be able to do like a heel lift or an orthotic, or you may have to do some type of lift where the actual shoe, you'll see people where they actually have addition to the bottom of their shoe where the sole has been thickened. Now the problem with that is they're going to have to do that on all those shoes. But it can really help people who are suffering from an actual anatomical leg length inequality. Part 2 to that is functional short leg or functional leg length inequality. This is where there might be what's called overpronation of a foot, where if you have your feet and one foot rolls in, so if it rolls in or pronates inward, that's going to cause the knee to come in on that side, and it's going to cause the hip to drop down. And so now they're going to have, when they lay down on the table, and you look down at the soles of their feet, or above on the shoe where the sole isn't worn, maybe the top of the sole. When you look there, like one leg, you'll look and be like, it'll be a ½ inch shorter. You're like, oh my gosh, what's going on? Well, there can be a lot. There could be a foot issue going on. There could be a problem in the knee, or there could be a problem in the hip. And when I say hip, I'm talking about the ilium, the sacrum, but also I'm talking about looking at the lumbar spine, the lower back, and seeing if those joints are fixated or subluxated and they're not moving well. That can cause nerve impingement and cause lack of nerve flow to the muscle, and it can cause the muscle to spasm and for the muscles to get tight and pull together, and it will cause that leg to shift and move, making it appear short or function short. And usually within 4 or 5 visits of going through and doing all the testing and clearing it out, the functional short leg can be corrected. Now people will tend to have a pattern to go back to the same pattern. It's like, oh, it's always been my left hamstring, or it's always been my right groin, or something like that. So looking for those vertebral subluxations, or the joints in the pelvis that just aren't moving well, there should be a little bit of movement in there. And of course, looking at the knee, and the knee being the tibia, the fibula, and the femur and patella. So you're looking at everything, but you got to think about it. A lot of those muscles, you look at the gastrocnemius and soleus, and traveling down into the calcaneus, or the foot. So really, you got to look at the foot, you got to look at the knee, the hip, and the lower back. And really, if you look at it, you should really look at the entire spine. So that's where in our office, when you come in, we do those 100-point checks. And we check it and we see, hey, you failed 20 out of 100. That's 80% passing rate. Hey, you failed 40 out of 100. That's only a 60% rate. And I didn't say passing rate. So really looking at where someone's at, assessing everything, because there was a study, was Spine, 1999, and they looked at, was 130, I believe it was 132 people, and 79% of the people who were in this study and they looked at had leg length inequality. So it was a group of people, all of them had herniated spinal discs, and 79% of those people, 79%, all had a leg length inequality. So just looking at that causation versus correlation, and making sure that you're functioning well from the ground up. Make sure you're getting your feet adjusted. There's 26 bones in each foot. I dedicated an entire chapter in my book as to why do I adjust my patient's feet? Why not? It only takes a few seconds per foot. And if I can do that on all these people, oh my gosh, it can make such a difference. Because when people get older, the older people that come in, it's like, my feet are so sore when I get up in the morning. I can barely walk to the bathroom. After a couple weeks of coming in, it's like, man, my feet feel better. That's a big deal because it's not what brought him into my office. What brought him in was the low back pain in the morning. I get up out of bed and I feel like an old man, right? We want to help people with that. So if you haven't been checked, we'd love to check in our office or find a chiropractor wherever you're at. We've got people in different countries watching these videos, which is so awesome for me. I love it. I love and appreciate all of you, especially when you like these things on Facebook and on YouTube and Instagram. It really means a lot, and I want to keep putting out good, valuable information. If you have a question on a specific topic, I have topics outlined for 52 weeks in advance. So I know what I'm going to cover, but I have no problem switching it up and changing it up. So if you got a specific thing, reach out to me on social media. Let me know. You can email me at drpeters@peterswellness.com or just put something in the Facebook and let me know what you're interested in hearing about. So have an awesome week. And remember, 2019 is coming up. Make it the best year of your life. Have a great week.